Peace and love, everyone, and thank you so much, Mary, for the introduction. It's an honor to help kick off the 6th Annual National Home Care Cooperative Conference. As cooperative developers and supporters, care workers, and organizers for justice, you are all doing such excellent and inspiring work. And the subject of this conference brings together many issues and themes. Hold on, something happened to my mic check. Can you all still hear me?
Yes, you're good.
Awesome. Thank you so much. As cooperative developers and supporters, care workers, and organizers for justice, you are all doing such excellent and inspiring work. And the subject of this conference brings together many issues and themes that are close to my heart and that I have tried to put at the center of my agenda in Congress. I'm talking about workers' rights. I'm talking about economic democracy. I'm talking about the infrastructure of care that we so urgently need to build to unleash our full potential as a society. As a specific sector and as an area of struggle for justice, home care is very meaningful to me personally. Every older adult and every person with a disability should have the right to age in place and thrive in their own home and community. And that means access to affordable home care. I know from firsthand experience how hard it is for families to access that kind of care in the United States. My mother was relying on home care towards the end of her life. I also know from firsthand experience how hard it is to be a professional home care worker in this country because my oldest sister does it for a living and has done it for a living for over 20 years. This is one of the fastest growing jobs in the country and one of the jobs that has been rightly recognized and praised as essential during the pandemic. Home care is already one of the biggest sectors of our economy. So it is a scandal that in a country as wealthy as ours, home care workers are making poverty wages. And it is no accident that we are talking about a workforce that is disproportionately made up of Black and brown women and immigrants. They often lack benefits or the representation of a union. These are the conditions that my sister has faced throughout her career. If you look at the situation in New York State, and specifically in the district I represent, New York 16, you can get a clear understanding of the nature of this crisis and some of the solutions we need. In my state, 91% of home care workers are women, 91%, and 77% are people of color. Shockingly, wages are so low that over half of these workers rely on public assistance. And that is a big reason why my state has the worst shortage of home care workers in the country. In Westchester County, which is partly covered by my district, 20% of those who need home care cannot find the help they need. In the Bronx, which I also represent, we have the highest levels of elder poverty and the highest number of people living with disabilities in New York City. Obviously, this is completely unacceptable. Demand for home care is only going to keep growing as our population ages. Thankfully, a major part of the solution is now on the table in New York State, a bill called the Fair Pay for Home Care Act, which would require home care workers to make $22.50 an hour. Passing this would wipe out New York's home care shortage in the next 5 years, and it would pay for itself by moving workers off of social assistance and by creating new tax revenue. Along with my friends who are part of the New York Caring Majority Coalition, shout out to the New York Caring Majority, we have made a lot of progress in getting this bill close to the finish line. So what is happening at the federal? At the beginning of last year, I teamed up with Senator Elizabeth Warren to introduce a resolution called the Care for All Agenda. Our resolution calls on the federal government to dramatically expand and strengthen the care economy across all the different sectors and policies that are essential to our physical, emotional, and social well-being. And we have to do it with huge levels of public investment. Care and care work makes our economy possible. It makes social life possible. But our systems of care are broken or were never built in the first place. So our resolution outlines a holistic vision for how we can center care in the rebirth of our country. The Care for All agenda, excuse me, makes the case for guaranteeing care to all Americans so that at every stage of life, all of us can access the services and support that we and our loved ones may need: physical and mental health care, child care, home care, and paid family and medical leave. It says that we need additional support for unpaid caregivers, people with disabilities, and children. And we must eradicate child poverty. I repeat, eradicate child poverty. And the resolution emphasizes that we need to treat all care workers with the dignity and respect they deserve. That means high pay, excellent benefits, opportunities for quality training and career advancement, the ability to form a union and to have a real say in how their workplace functions, and adequate safety protections on the job. The worker-owned cooperative business model is a crucial part of this vision. And of course, as many of you know well, there is an example that looms large in this discussion: Cooperative Home Care Associates, which has a large footprint in my district and has been helping to lead the fight for fair pay for home care in New York. CHCA was one of the main inspirations for our resolution. All workers deserve a genuine voice and democracy at work, and they have a rightful ownership share in the wealth that is created by their labor. Those are the simple, powerful reasons why the worker co-op model is so important. Co-ops can also help facilitate the unionization process. When it comes to home care, we need deep structural reforms to be able to pay all workers a truly fair wage and to expand access to home care, which is exactly what we are fighting for in New York and at the national level with President Biden's Build Back Better legislation. Alongside those structural changes in Medicaid, for example, the formation of care co-ops can play a crucial role in building power and security for home care workers. This model allows agencies to play a creative, mission-driven role in developing and training the home care workforce and embedding care in the surrounding community, as CHCA has done so beautifully. And we have seen this kind of work happen in childcare as well. So the Care for All agenda makes a point of saying that all care workers should have resources and technical support to be able to form worker-owned cooperatives. And I am pleased to say that my office is currently working on a piece of legislation to flesh out that idea and promote the development and sustainability of home care worker co-ops across the country. I look forward to collaborating with all of you on that project as it moves forward. In our resolution, another point Senator Warren and myself made is that care jobs should be thought of as green jobs. These are not high carbon or polluting occupations. At the same time, home care workers, for example, are already on the front lines of the climate crisis. They have been first responders during extreme weather events and have taken grave personal risks to help the people they serve. And we also know that care workers were on the front lines of the pandemic as well. So as we cope with the climate crisis and switch to a zero carbon economy, let's remember that all kinds of new care needs are going to come up in our society. So we need to bring the climate and care conversations together. And equity is key here. Since the original New Deal left behind Black and brown workers in the care economy, particularly women, we have to make sure to lift them up and center them as part of our transformational agenda this time. Strengthening the care economy has to be part of the Green New Deal. And perhaps there are possibilities here for collaboration and cross-sectional thinking in the cooperative sector. At the end of the day, what we're talking about is building a society based on care for each other and for our planet. We are talking about revitalizing our democracy. That is the core message of the Care for All agenda. And I'm proud to say that it helps set the stage for the Build Back Better vision. As I'm sure many of you know, the bill that the House passed would make historic investments in care infrastructure and climate action together. And in home care, it would lay the foundation for expanding access to services and raising wages at the same time. And let me say this, Build Back Better is not dead. It is not dead. It is on life support. It can be resurrected. It is not dead. We are still fighting for it. We need you to still fight for it, and we need you to still organize to help us get this done. Apologies that I have to leave a bit earlier than expected because it's a very busy day on the Hill, as usual. But I know my brother Esteban Kelly from the U.S. Federation of Worker Cooperatives has something excellent in store for you. Thank you so much again for inviting me to be here today. Let's go build a new world based on cooperation and care, and let's build that new world together. Peace and love. Thank you all so much.
Thank you. Thank you so much. And we're hearing, this is one problem with virtual, is you can't hear all the comments, but they're coming out of the chat room. So thank you so much, Congressman Bowman. And I know you have an incredibly busy schedule, and we'll try and help you and get Build Back Better and everything done for the care economy. Thank you so much. And as he said and talked about worker cooperatives, we have the wonderful Esteban Kelly is joining us to update us on the worker cooperative landscape. He is the executive director for the U.S. Federation of Worker Cooperatives and is a worker owner and co-founder of E.d.D, Anti-Oppression Resource and Training Alliance, a worker co-op that has built capacity for hundreds of social justice projects through intersectional training, facilitation, and consulting. Esteban served as a mayoral appointee and co-chair of the Philadelphia Food Policy Advisory Council, go Philly, shout out, and was elected to the board of the International Worker Co-op Association, COPA. Currently, he is a Ford Global Fellow, a Margaret Burroughs Fellow in the Social Justice Portals, and an advisor to the Movement for Black Lives. Join me in welcoming the wonderful cooperator, Esteban Kelly.
Thank you so much for that warm introduction, Mary. Okay, and I believe, yes, you have my slides, excellent. So, buenos días, buenas tardes para todo el mundo.
Good morning, good afternoon to everybody. Hello to everybody in all parts of the country. I am going to present in English, but first I wanted to say a few words of welcome to everybody. And I'm very happy to be able to present this information on the cooperatives of worker cooperatives.
I'll give you a second to switch over for the interpreters. Thank you. Because it is very nerdy information that I want to present. Some of this is data driven and some of it actually will get into the initiatives that the Congressman started to share. But first, do you mind jumping to the next slide? A lot of what I'm presenting is just some highlights from the State of the Sector report that we conduct. This is done jointly with the Democracy at Work Institute and the U.S. Federation of Worker Co-ops. And you can see the information here about where to find that report in its entirety. And y'all, we put a lot of work to make sure that it's digestible and accessible. So what you're downloading is not going to be raw data and a lengthy report. It's about 4 pages with a lot of graphs and charts. And so what I want to do is just highlight a couple of those graphs and charts that tell the story about worker ownership as of the past year and a half, going about a year or so back, and in the caring economy in particular. So yeah, you can find it at institute.coop. And before I advance to the slide, just on this one real quick, I'll say a couple things about the data itself. What we have here represents the experience of about a third of the verifiable co-ops who we were able to get responses from for our survey. So it represents about 180 worker cooperatives and democratic workplaces that actually participated in our biannual economic census that we conduct. And we estimate we have to make projections beyond the co-ops we were able to verify, which were 612 businesses that we were able to verify. And within that, 180 of them actually responded to our survey. So it represents that, but we estimate there to be about 1,000 cooperatives and somewhere around 10,000 worker owners, which is a tricky number to estimate given the flux, where some sectors saw growth in the last 2 years, some saw a lot of contraction or layoffs, given the realities and hardships of the pandemic. So at a high level, that's a little bit what we're looking at. And you'll see on this map just some of the hot spots of where that growth is concentrated. Not necessarily the growth, but just what the state of the sector is as of us gathering this information over the last year. Those green dots, the lighter green, represent areas that weren't on our previous state of the sector report. So they didn't quite meet the threshold of having a concentration of 5 to 10 co-ops in that area. So those ones are new on the map. And you'll see that there are areas in the South, in Appalachia, that are in that category, and even in other rural parts of the country, like up in Vermont. Okay, we can go to the next slide, thanks. Excellent. So most worker co-ops that we're seeing are still self-started. This isn't much of a change. So it's been consistent over the last decade. We're looking at about 70% of them are self-startups, and then about 12% of them are conversions, or we sometimes call that ownership transitions. And then the other 18 are assisted either as outgrowths of a franchise development or from nonprofits who help to incubate co-ops or other kinds of initiatives that are not just the founders in a startup or the existing workforce transitioning their business. Next slide. Yeah, so worker ownership also continues to be a movement that's led by women and is a home to many workers of color as a viable option for startup or ownership transition. So that part hasn't changed. We have seen a little bit of scrambling demographically among Latinx workers and white workers, just given the dynamics of some of the layoffs, especially in the childcare and home care industries. But it is a volatile data set to be tracking and following there. If you go to the next slide, it shows a little bit about the pay ratio, which is still pretty consistent. We're looking at a 2-to-1 pay ratio between the lowest paid workers in worker co-ops and the highest paid workers, which of course is a dramatic contrast and maybe underscores some of the remarks from the Congressman about the importance of building out the solidarity economy and cooperative enterprises because of its impact and being able to capture more of that wealth among the workers inside of businesses who are generating the income in the first place. Okay, we can keep going. Yeah, so most worker co-ops, we just talked about this one, so you can go to the next slide. Sorry about that. Maybe went in the wrong direction. Yeah, despite the pandemic and the economic downturn, co-ops remain committed to values and practices that we've always centered. This is just a little bit of information about some of the common practices, the ones that really were most consistent across the co-ops that we surveyed, which again was just about 1/3 of the verifiable worker co-ops. And you'll see that the highest one was about having a pathway to ownership for candidates or some of the workers who aren't yet members, that's clear and established by their policies or bylaws. And then next, just having some consistent financial practices around a business plan, an annual budget, patronage, and things like that. Okay, next slide. Just takes a bit of a look, and there is a lot more data in the report itself about how co-ops fared during COVID-19 and what that impact was for some of the local and regional mutual aid networks, how we sort of responded and resourced our communities, and different ways that we were actually able to leverage the asset. I mean, we talk a lot about cooperative ownership being an asset for individual worker owners, but it's also a community asset, a family asset, just as a resource that's embedded in the community in those moments of crisis. And so 73% of the co-ops that we surveyed actually were able to offer some sort of discount or resources to meet community needs. And another 60% offered resources to another co-op during the pandemic. There's a lot of stories that we've gathered. Hopefully, those of you participating today have heard some of those stories. On the next slide, it talks a little bit about the operations and the staffing. So the internal aspect of the impact of COVID-19. Worker co-ops basically prioritize preserving jobs throughout the pandemic. And the co-ops that we surveyed experienced reductions in revenue, but the total hours they worked remained nearly flat compared to 2019, so a couple years prior. There's some other data there, just basically capturing what that picture looked like for retention and hours and some of those aspects. Okay, so in the next slide, I'm going to pivot a little bit, just in my last few minutes, to looking at these issues of policy and advocacy. And I'm glad that conversation was started. So if you go to the next one, there's a map that just sort of shows some of the areas, and there are many where we have a lot of worker co-op initiatives happening on the ground, either at the state level or locally. So the green, those little green stars indicate states where there's active legislation or investments in worker co-ops. That kind of fading yellow is where there's interest and relationship building that's happening in a grassroots way from our members with our support and through our coalitions. And I just wanted to highlight a few places that are incredibly exciting to me. One is in Colorado. The Office of Economic Development is making grants to fund the startup and growth of worker-owned cooperative businesses, which is a really cool initiative that our partners on the ground are working on there. In New York City, of course, we continue to have a build on the program with the city government, where there's over $3 million a year that are going toward the Worker Cooperative Business Development Initiative, with the release of the New York City Worker Co-op Advocacy Platform, in addition to statewide work. So that is exciting momentum and is definitely having an impact. Then just a little bit further north in Massachusetts, there are currently 4 bills from the Coalition for Worker Ownership and Power platform that are currently moving at the state level. Some of our policy and advocacy fellows, we had our first advocacy fellowship last year, were able to host a virtual tour of some of the co-ops throughout the state of Massachusetts for elected officials at the state level, state senators and representatives. And then if you go to the next slide, take a look federally. So this is some of what the Congressman was just alluding to. So we're working obviously with Congressman Jamaal Bowman of New York, but also with Representative Ro Khanna in California on legislation to directly support worker co-ops. There's a wide net of worker co-op support and development that it's kind of farmed out into different pieces of legislation with Ro Khanna. And then we're also focusing on the care economy through legislation supporting home care co-ops, again, through various initiatives. Some of the other things that I do just want to highlight before we close out is an effort to bring the Small Business Administration into compliance with the Main Street Employee Ownership Act that we passed a few years ago. The Capital for Cooperative Act would remove the personal guarantee requirement for cooperatives that are seeking access to 7A loans. It would also direct the SBA, the Small Business Administration, to replace the personal guarantee requirement with an alternative measure to determine a cooperative's credit risk. So swapping that out. And the Department of Agriculture's Business and Industry Loan Guarantee, they have a collateral requirement for cooperatives that could act as a guide for actually meeting the need of SBA. So we're sort of looking at that. And then this Regional Innovation Hub Act, it's now part of America Competes in the House and in the Senate. It's legislation that would support regional economic development and resilience, including worker cooperatives as a key component. So the bill promotes the benefits of technology development and innovation for all folks in the US, including underserved communities and vulnerable workers, to support domestic job creation and broad-based economic growth. So you can learn more about that through the Federation's website, or you can reach out to policy at usworker.coop to help inform the legislation, because I know many of you who are here are participating in that. And lastly, just want to give another shout out to CHCA on the next slide, where a lot of our members were involved just about 3 weeks ago. Over 250 workers attended the Have a Heart for Home Care Workers and Support Fair Pay for Home Care rally in Albany, including our member organization that already got a lot of shout out and love in the chat, Cooperative Home Care Associates. So there were workers from the Bronx, Queens, Manhattan, and Brooklyn in attendance, including our delightful board member and secretary, Denise Hernandez. And I think the last slide is just about the Worker Ownership State Advocacy Fellowship that I started mentioning, which had a couple fellows from 5 different states. They were selected for our first cohort. We just had a report back about that, and I think the Zoom on our policy pulse and report back on that fellowship is posted on our website. So I won't take more time to dig into that now, but we're very proud of the work that they were able to accomplish, and building relationships and learning about lobbying, advocacy, and really building that pipeline for some of the relationship that the Congressman was starting to talk about earlier. Okay, so I don't know if there's still time for any questions, but if not, I can introduce the next speaker.
Esteban, we are ready for the next speaker. I'm sorry, there's not quite time for questions.
Yeah, that's totally fine. I mostly was trying to leave some breadcrumbs so you can follow up in the appropriate places. But that means, though, that I have now the pleasure of introducing Iwona Matczuk, who is the Senior Social Enterprise Consultant on the Home Care team at ICA Group, where she specializes in business analytics and business development. Iwona will report out on the results of the 2021 home care cooperative sector benchmarking survey results, which are based on CY 2020 data.
Great. Thanks so much, Esteban. And that was a great presentation and a really great partner to kind of what I'm going to talk about today, I think.
Excellent.
And then kind of zooming in a little bit. I am going to share my screen. I just want to make sure that everyone can see what I am seeing. Can everybody see that? My main title slide?
Yes, we can.
We can see.
Okay, great. All
Oh,
right.
Iwona, we can see your notes though.
Oh, of course, naturally. All right, let's switch it up. Okay. So yeah, again, good morning and good afternoon to everyone wherever you are in the world, and happy International Women's Day. I'm excited to be here with all of you to share the results of the 2021 home care benchmarking survey. For those of you that are maybe new this year, just so you know, the ICA Group sends out a survey every year to our home care cooperatives and our home care cooperative network to collect data, financial data and operational data about the year prior. And then we kind of aggregate that, analyze it, and present it here at the conference every year. And then we follow it up with a more detailed and kind of robust report. So that will be coming soon. I'm excited this year to kind of celebrate the strength in the members we've had and the home care co-op resiliency in times of crisis. I am Iwona Matczuk, as Esteban said. I'm a senior consultant here at the ICA group. And my work really kind of centers on helping our existing and established or our emerging and established cooperative fortify their business model through kind of industry-specific information. Because we're all virtual this year, I thought it'd be helpful to kind of share my caregiving story. It kind of goes a little way back in my life a little bit, but almost all of the women in my family have or are domestic workers, but more specifically, my grandmother and my great aunt were long-time kind of live-in caregivers. And so my grandma lived with us for a really long time when we were kids, but she would only live with us on the weekends because during the week she would stay with who she was taking care of. And I remember she'd come home on the weekends, kind of tell us her stories and what she was doing all week. And I remember thinking that, you know, my grandma takes care of other people's grandmas, so my grandma must just be super, super strong. And I think that that's kind of the way I like to continue to think about caregivers. We're all just really super, super strong. And so with that, I'm excited to kind of share our results. So 2020 felt like an impossible year, and we all went through a lot. So I think that deserves to be recognized. And I just want to really offer a moment of reflection on that, really for the hardships we all experienced, for the isolation we all had to navigate both emotionally and physically, for the family and friends that we lost, the communities that got stronger, for the new communities that we got to form, and really for the strength that we found in ourselves that we didn't know we had. You know, we're all here today having gone through that, and I'm sure we all experienced hurdles and barriers that we never could have imagined, and you know, we got through it, and really that deserves celebration. So glad to be here with all of you. And I think it's really important to be thankful that things are relatively better today in March 2022. You know, we understand the virus much better. We have access to vaccines. But in 2020, really fear and uncertainty gripped the nation. And while people sheltered at home and figured out how to work from home, caregivers were very much still out in the field providing services and doing the best that they could. Guidance and instructions were slow. Supplies were non-existent, if in short supply. And programs like the Paycheck Protection Program and Emergency Economic Disaster Loan, while incredibly helpful in helping our cooperatives stabilize, were really chaotic and unclear when they were first rolled out. So things, you know, just continued to kind of spin and get charged. With all that said, I think there's some silver linings that came out of 2020. You know, Representative Bowman and Esteban kind of talked about all the policy that's being moved forward that had been being worked on and is continuing to being worked on. I think that's a really great, you know, outcome of all of this, really highlighting the care economy. And something that I felt was incredibly compelling, but maybe we don't talk about enough in the home care industry, is really how unemployment benefits really held a mirror up to the home care industry and its treatment of low-wage workers. You know, when caregivers opted to stay safely at home and receive more income through unemployment benefits than being out in the field, that was, you know, the industry really reacted to that and really kind of saw its own reflection in that. And I wish I could really end my presentation just here being like, in summation, this is what 2020 was like for home care cooperatives and home care cooperative administrators. But that's not what I do, and that's not what I'm here for. But I do recommend all of you sharing your gifts and memes for what 2020 felt like for you in the Uva app. There is a channel for this presentation, so feel free to drop it in there. There were way too many for me to choose from, so I just chose these 4. And kind of talking a little bit about the co-op sector during COVID, you know, when the nation shut down, our cooperative sector grappled with its own new reality, as well as trying to rally around our cooperatives and provide support. There were efforts to help translate rolling and confusing regulations, webinars to help better understand funding opportunities, calls to better understand the developing issues with each cooperative, and simultaneous efforts to both make and find or buy PPE. So altogether, about $398,000 was distributed in grant assistance to our home care cooperatives from multiple different funders. 70% of our home care cooperatives received some form of loan assistance, as well as 70% received PPE donations from their community. And I also want to highlight that ICA Group partnered with Equal Exchange to purchase and store PPE for our home care cooperatives. So why does benchmarking matter? We know that filling out the benchmarking survey is a pain, but I can't stress enough how valuable this information is, not only for demonstrating our sector's importance, but for your ability to make informed decisions about your cooperatives. And we can go on and on about how benchmarks and metrics are important for internal and external communication, but with all of those reasons, we really found that everything kind of boiled down to three main points. That measuring and using metrics and benchmarks to the industry help make businesses stronger, because you can essentially make decisions knowing what the cause and effect of your decision could be. And using metrics to make decisions helps strong businesses make more profit. And more profit means that your board and the management of the cooperative have more money to invest in caregivers. So whether that's through patronage, wage increases, benefits, it's really up to the cooperative at that point to decide what to do with it. And I quickly want to recognize that we're presenting 2020 data. And given that it's March 2022, some of this may feel irrelevant. And I completely understand that, but I do think this presentation could be a time for active reflection. It's very easy to kind of think back on 2020 and shudder and just move on. But a lot happened then and in a really quick time. So it's important that we kind of look back, reflect, learn, and congratulate ourselves for what happened. A little bit about the survey. For the 2021 Home Care Benchmarking Survey, 13 cooperatives submitted responses, and 10 of those cooperatives actually served clients in 2020. So their data was primarily used for the analysis. The data for the 3 other cooperatives is incredibly helpful, and we continue to use it to better understand the barriers and hurdles that these emerging cooperatives are kind of dealing with every day. Some good news, we saw 2 newly incorporated cooperatives added to the network, one that was able to serve clients, but one that has not served clients yet. And unfortunately, 2 of our past cooperatives had decided to kind of pause operations and reevaluate their approach, which was a common occurrence in 2020 for many businesses. Zooming in on the 10 cooperatives who served clients just for a little bit, we saw that 1 new cooperative launched at the beginning of 2020. Shout out to Ridgeline up in Washington. I know you're here. 8 out of 10 cooperatives have less than 50 employees, so we consider those small cooperatives. And 10 out of 10 cooperatives actually accept private pay clients, but only half of those are exclusively private pay. This is pretty important because this is a reduction from previous years. And it's really showing that our cooperatives are finding or developing more and more payer diversification. So you can see in this blue box that the 5 other cooperatives each has its own unique payer mix. Payer diversification really helps businesses be more resilient in times of change and crisis because they're not reliant on one single source of revenue. And it's really something we encourage in all of our cooperatives, not just home care. And if I haven't been clear already, I want to reiterate that 2020 was a hard year for our cooperatives on many fronts. I'm going to keep some of our metrics really high level this year because I don't really think there's anything gained in continuing to dig downwards. But there will be more detail in the 2021 report, and you can see that when it comes out. We will be sending out emails and blasts for that. So in 2020, total sector revenue went down and total client hours also decreased. That's really unsurprising. But what I think was particularly surprising was that two of our longer, more established cooperatives, however, experienced rises in revenue and client hours. Quarterly speaking, in Q1 and Q2, they didn't take very big hits. But what was most impressive is that in Q3 and Q4, they were able to kind of harness the growing demand for home care and serve those clients to the best of their ability. Anecdotally, we already know that these two cooperatives have already surpassed their 2020 benchmarks or 2021 benchmarks and have been able to really invest and kind of congratulate their caregivers through increases in wages and different programs. So we really want to stress how exciting that is. But wait, there's, this isn't all bad news. By the end of Q3, we were beginning to see a rise in revenue for the sector, and that trend kind of continued into Q4. I'd like to add that this revenue was most likely increased by the financial assistance received by cooperatives early on in the pandemic. But that financial assistance was really greatly needed in order to stabilize our cooperatives. And it's important to remember that it came in tandem with our cooperatives continuing to serve clients. So this growth is both organic and assisted. The red trend line is showing upward growth, but that's not to imply that things have been continuously strong and stable since 2020. The cooperatives really continue to experience growth from demand, but additionally, they really struggle from disruptions of new variants and just the utter lack of caregivers to fill hours. The home care business in the last 2 years has really mirrored the trajectory of COVID and its ebbs and flows. And again, because 2020 was such an anomaly of a year, in so many ways, we're keeping our presentation of financial metrics really limited. So for this year, we're introducing 2 new benchmarks, gross margin and profit margin. And in general, the thing to remember about margins is bigger is better. Big margins mean big money, which is not that simple, but it's an easy way for me to remember it. A bigger gross margin means you have more to invest in expenses that don't generate revenue, like rent. And more net profit means you have more to invest in caregivers, whether that's through patronage or increased wages. So in 2020, the sector's median gross margin was 23.7. And what this means is that for every dollar the cooperative sector earned, they spent about 76% on caregiving expenses. So that includes caregiver wages and mileage reimbursement. And they were able to keep about 24 cents of that dollar to invest in non-billable expenses. And it's important to keep in mind that these numbers presented here only represent billable hours in 2020. They do not include the effects of grants and loans. So just to keep that in mind. And so looking at the larger industry, our median gross margin is much smaller than the industry's 35.9, which makes sense given how much cooperatives value caregivers and center them kind of in their decision-making around wages and mileage reimbursement and things like that. So if we were to add back in the additional revenues earned from, the economic assistance or the financial assistance that was received in 2020, the sector's gross margin would actually rise to 33.2%, giving each cooperative a greater cushion to invest in things like PPE, admin salaries, and technology. Gross margin really is one of those benchmarks that can be looked at to gauge how profitable providing services are. If a cooperative kind of raises rates but continues to serve the same amount of hours, the gross margin will go up. Or if a cooperative raises wages but doesn't increase rates, then gross margin will decrease. So what I'm trying to say here is that it's really ideal for each cooperative to have an understanding of what its average gross margin is, so that if it rises or falls, board members and management can really start to investigate and ask questions as to why, and then be able to intervene. Additionally, a larger net profit is always better. More net profit means the business has more money to put away in cash reserves for emergencies or invest in the business through new technology. And I think what's particularly interesting, and we all are incredibly familiar with, is that a net profit also can result in patronage or dividend distribution, which really is what sets cooperatives apart and kind of proves that cooperative difference in home care. So the sector's net profit for 2020 was really unsurprisingly low at 1.3%. But when we added back in the financial assistance, that net profit increased to 12%. Now to talk about the fun stuff. In 2020, member owners really kind of shone through in the metrics, and I want to personally acknowledge and congratulate member owners who continued to work and were dedicated to providing care during COVID. In 2020, the sector's membership rate went up 10 percentage points from 58% to 68%. So of the 1,800 member owners, about 68%, or I'm sorry, of the 1,800 staff employed by cooperatives, 68% of them were member owners. And in fact, that's our highest membership rate yet. And we also noticed that small co-ops, which is that gray line on top of the blue line. So the blue line is our cooperative sector, and the gray line is our small cooperatives. So again, less than 50 employees. They usually have a higher membership rate. And in 2020, they had an average membership rate of 72%. We estimate that this is due to the more hands-on culture that small cooperatives are able to foster, both with new and senior staff. Feedback is really much easier to hear and act on at smaller businesses. And while it's exciting that this has been our higher membership rate to date, it's also just so happens to be, while our membership rate increased, our non-member staff numbers decreased. So looking at the gray bars are non-members. You can see that between 2019 and 2020, there's a significant difference. In total, the non-member count of staff, which are primarily caregivers, decreased about 74%. And between 2019 and 2020, the sector's member owner count actually decreased by only 19%. So I think it's really interesting that our member owners stay, they are committed, and that really proves something there. For 2020, we adjusted our trend analysis to actually look at median turnover instead of average turnover. This was a mistake in the past, and all of these comparative figures to the industry have been adjusted in order to kind of match where the industry was at the same time. So But overall, year over year, our sector continues to have an industry-leading turnover rate, with 2020 having a median turnover rate of 41% to the industry's 65.2%. And a compelling occurrence that I kind of just want to highlight here is that in 2018, when the industry was struggling with an 81.6% median turnover rate, our cooperative sector actually had its second lowest turnover rate of 30%. And really lastly, for old time's sake, I wanted to, just highlight that the average caregiver turnover rate was 35%. That's 1 percentage point lower than the 36% we highlighted last year. I don't want to trivialize the uncertainty and struggle that was 2020 for our home care cooperatives, but I thought showing this visual of the quarterly turnover rates for our cooperatives would demonstrate really just how chaotic the year was. Holding on to caregivers with all that was going on during COVID, with more safe and secure option of unemployment, the competition between home care businesses to recruit new caregivers was incredibly difficult. And really, even with all this going on, home care cooperatives continued to serve clients when other home care businesses really shut down or sold. And I could probably say this in a more eloquent way, but nothing really summarizes it better for me than just wage data for 2020 is weird. Increasing wages was really one of the main strategies that home care businesses use to attract and kind of recruit new caregivers. And because of this and the financial effects of state and government incentive programs, our wage data for 2020 is hard to really properly compare to past wage data. So I won't be presenting the wage differential figure that we typically do right now. I'm still working to really qualify that number and identify all of its external influences, but I will be working to get it into our 2021 report. So keep your eyes out for that. Instead, we can demonstrate that cooperatives raised wages far more than their industry counterparts. So in 2020, on average, cooperatives raised wages by approximately $3.18 more than their non-cooperative industry counterparts in those same states. So that's a differential of $2.73 more than the industry. This figure could include state mandated wage raises like in California and New York that we've seen in the past, but overall cooperatives were more responsive to the market and caregiver needs. I think it's important to note here that in 2020 was really a year of crisis. By the time one decision was being made, something else was kind of flying at the cooperatives, whether it was, workers' compensation mandates, unemployment, minimum wage hours, or guaranteed hours, sorry, that's what I meant to say. And this figure is relatively positive. It is positive, but it's also, it's not really representative of the strategic decision-making that our cooperatives usually employ when thinking about wage increases and things like that. It's a little bit more reactive, so it's important to keep that in mind. And to be clear, we really only looked at the wages of 7 states that our cooperatives operate within from 2019 to 2020. The previous slide demonstrated average wage increase, but this slide talks about the range of increases. So the center figure is the median wage. And within the 7 states, home care cooperatives still made higher increases in wages on both sides of the spectrum, with the lowest cooperative wage increase of 2020 being 50 cents and the highest wage increase in our sector being $7.19. I'd like to recruitment is the thorn in everyone's side in home care, but I do want to spotlight some key things. When it comes to client recruitment, word of mouth continues to be the main pipeline for new clients. And really a common practice in the industry is to thank or reward clients who refer other clients to you. It's really a way of reinforcing gratitude and building loyalty and trust with clients. And unsurprisingly, managed care organizations continue to be the #1 referral source for public pay cooperatives. And that really highlights the power that MCOs have in supporting a home care business and its reluctance to raise rates as a result, right? Like that's the biggest problem with MCOs and their rate settings. 3 cooperatives received about 40 to 50% of the referrals from institutional settings like hospice and hospitals, highlighting our sector's sector's, innovation, or not innovation, but really importance of kind of building those strong referral partnerships. And 5 cooperatives received 25 to 50% of the referrals from what was considered an other category. And I think that demonstrates how resourceful and kind of innovative our cooperatives are and cooperative administrators are in building relationships locally. So for 2020, home care cooperatives were able to retain their clients longer than the industry average of 13 months by an additional 4 months. So our industry average for client tenure is 17 months. And the kind of the range between those was like 5 months to 38 months. So you can see that that span is actually quite wide. And for those of you that don't know, caregiver recruitment is really the current battlefield that all home care businesses are fighting on. That includes our cooperatives. No matter which industry event we go to, whether it's a training or a webinar, everybody's talking about recruitment and trying to figure out how do you recruit? How do you recruit? What job posting do I need to, what do I need to put in my job posting? Where do I post it? Like what kind of benefits or incentives do I need to offer caregivers? And people are really looking for what seems like a magic bullet. And as we all know with magic bullets, they don't exist. And what's often not said that in this battle for recruitment, there are going to be winners and there are going to be losers. And many home care businesses have already decided to close their doors just because the constant management of client hours and caregiver recruitment is just exhausting. And for people who have been doing this for a long time, this feels kind of like the final nail in the coffin for them. What I want to highlight here is that home care companies that can authentically approach building, healthy work cultures and really support their staff in, earnest ways are going to be the ones that come out on top. And knowing this really sets our cooperatives up for success. But investing in caregivers and really fortifying the cooperative model in home care takes time and money. So it's imperative that we work to make these cooperatives stronger so that they can make strategic decisions that allow the entire business to kind of rise and succeed together. We did ask some questions, some kind of projective questions in the survey that I thought would be really helpful to present here. And so these really talk about 2022 and beyond. We asked our cooperatives, thinking of the year ahead, what do you see as the biggest challenge for your cooperative? Of course, recruitment and staffing and caregiver recruitment really stood out, and reaching more clients and unable to accommodate referrals. One cooperative has even said that they're cutting existing client service hours in order to accommodate new incoming clients. And what do you see as the greatest opportunities for your cooperative? To grow as a co-op and have a clear vision of emergency preparedness planning. The opportunity to grow the business is there, and really establishing our sales and marketing. And what do you hope for the cooperative home care community in 2022? Growth and expansion, to get more member owners, to see more startups and more group marketing activity, and to have more coordination with other folks in the home care industry. And because the sector is continuing to grow and develop, we thought it would be helpful to add some categories for the cooperative, for the cooperatives in our sector. So for 2022, we added both emerging and established as qualifiers for the cooperatives in our network. Established really means cooperatives who are actively serving clients, and emerging talks about those cooperatives who are either about to get licensed, recently got licensed, or are in the early stages of launch. So in the home care cooperative sector, we have 11 established cooperatives indicated by the gray dots here on this map, and 6 emerging cooperatives indicated by the brighter blue spots. Some notable additions this year is Heartsong, the 5th home care cooperative incubated by NWCBC in Washington, increasing the state census to 5 home care cooperatives. I recommend attending their session today at 4 to really hear more about the efforts and plans in Washington state. And secondly, the community care cooperative in Texas is going to be the 2nd home care cooperative in Texas, and they are being incubated by Sankofa Research Institute, led by Asada Richards, a really innovative community leader who's presenting Wednesday at 3 p.m. And with that, I'm happy to take questions. I encourage all of you to write down my contact information. It's also available on ICA website. I'm more than happy to talk and answer questions about anything in this presentation. Thank you.
And Iwona, there is a question in the chat that was asked by Tara. What is the primary reason non-members remain in that status? And is there a clear path to membership?
Yeah, I think that's a great question, and really something we should probably dig into with each of the cooperatives. Each of the path to membership is unique for each cooperative. Each cooperative kind of sets their qualifications for membership in their bylaws, and it's really up to them to really make sure that they are encouraging and kind of reiterating what those benefits are to non-members when it's time for them to kind of be voted in, if voting in is kind of the pathway that they use for membership.
And if anybody has any more questions, please feel free to pop them in the chat.
And if your questions kind of come after the fact, I'm here on my computer all week. You can message me on the Whova app. I'm kind of here, happy to kind of share. Again, a lot of this is going to be talked about in our 2021 benchmarking report, as well as kind of those more detailed components that I wasn't able to really dig into today because it's just not positive, or it's just too complicated to kind of talk about in this way, in this kind of format. So I'm happy to discuss that on a separate channel if that's what needs to happen.
There was one more question that came in about profit rate. Is there a target net profit rate beyond more?
I think higher than 1% is probably good, but the answer is more. Yeah, 4% is, if that's what the industry standard is, then that's what you should really like target. And if you can get more than that, that means you're really either using efficiency, you're kind of efficient in your overhead, and that's really kind of the goal there.
And do we know that the industry benchmark data excluded government support funds?
I don't know, actually. That's a really great question. I believe it most likely did, but we'd have to dig into that a little bit more. I didn't really compare industry revenue and our revenue. I really don't ever do that because theirs is just so much more. It doesn't really help for us to compare ours against theirs.
And what is the average cost for the startup home care co-op?
That could really vary depending on the cooperative's needs. We do have a document that kind of outlines the buy versus build conundrum for startups. We estimate that anywhere around $100,000 is probably adequate for a startup, but there will always be needs in terms of a line of credit or maybe a loan from the Fund for Jobs Worth Owning. Could always help bolster and kind of provide that figure. That document will be in the launch box. Thank you, Katrina. Yes, 100,000 assumes startup administrators are paid. Kippy is correct. P&L reports would not include loan revenue. They would include grant revenue. There aren't any more questions. I think we can kind of transition into a break. I'm sure people need a bathroom break or a water break. And I'm happy, well, obviously we'll share this recording and this presentation out to everybody else. Thank you so much. It was lovely seeing all of you. And again, keep the questions coming.